Let's talk about something that's really serious that's happening in the news, and something, when you look at the news and you hear about a young person doing something horrible, you hear about suicides a lot, you hear about shootings. Oh my gosh, it breaks your heart. You know that these young people, they have everything. They have their whole future ahead of them, and then they make these crazy choices. The whole world, we're all in love with our technology, but these, the kids are looking at Facebook and they're getting bullied through these things, and oh my God, I hate it. Like when we put something on YouTube and somebody gives us a negative comment, I hate it, and I'm 63 years old. Can you imagine if you were 15, 16 years old and you're getting, slammed by people who just like to be mean and nasty?
Yeah.
So anyway, this is really psychologically it's affecting us psychologically as a society. Dr. Bela Sood is going to talk about this. She is a child and adolescent psychologist and the senior professor for child and mental health policy at the Virginia Commonwealth University Department of Psychiatry at the Virginia Treatment Center for Children. So while psychiatry and psychology are something we all need to pay attention to, for some reason, what's happening to our kids? I don't know. She's going to tell us how to spot the warning signs. Good morning, Dr. Sood. How are you?
I'm doing well. Thank you for having me.
This is such an important topic. I don't think this was talked about even just 10 years ago.
Absolutely, and I think that people would be surprised to know that 50% of all mental health issues that present in adults are there by the time you're 14.
Is that right?
And by the time you turn 25, 75% of all of those illnesses appear. So childhood is a period where we've always known that most of mental health problems begin. They need to be recognized, and you need treatment and intervention, and you can really prevent some of the negative outcomes which are there if you intervene early.
So it used to be that I would be like the armchair psychologist and say, oh, they must have had bad parents. That may not be true. And in today's day and age, the parents might be really good, but maybe the kids at school are being mean to them, right?
Well, I think you're asking where does mental health issues arise from?
Yeah.
And I think we do know now very well from the science that a lot of it is transferred genetically, meaning that if you have a parent or an uncle or a grandparent who has had problems, generally those kinds of disorders transfer onto the child. And in the right kind of environmental circumstances, many of those which you have just alluded to, which is the high stress conditions which are there in our environment, along with a temperament which makes the child much more vulnerable to the development of these illnesses. So it's sort of a complex type of a phenomena, but we do know that it is genetically transmitted just like any other physical illness which we know of, which runs in families.
But sometimes I think it's because the parents don't want to be a parent. They want to be a friend, and that's all there is to it. They don't want to instill in their children love and discipline. They just want their child to go out on their own.
Yeah, so you're referencing a specific problem which has to do with parenting and discipline, which leads to untoward behavior. And that needs to be differentiated from major mental illnesses such as depression or ADHD or other things which would occur irrespective of good parenting. But I think you're bringing up a very good point of how do parents set appropriate boundaries? How do they do those kinds of things which keeps their children from coming into harm's way? So parents do play a very important part in the raising of kids, but sometimes illnesses will appear no matter what. The good news is that if you recognize it early enough and you intervene, that the treatments are very effective in preventing complications.
Really? So it's really like no other disease. I mean, it's like the others, I should say, in that the earlier you catch it, the better, right?
Absolutely. A kid can have diabetes, and if you do appropriate intervention, you can stop the kidneys from getting worse or the eyes from, getting poor eyesight. Right. But again, that goes back to treatment, early treatment and intervention.
So when you're talking about treatment, is there some form of medication that's involved, and does the child have to take it forever, or can they not have any medication?
Okay, and I think that's zeroing into specific disorders, and so treatment with medications is part of a multi-pronged treatment. So there's not only the medicines, but is also appropriate counseling, supportive therapy, and the right kind of interventions which are put into place, which can get the developmental course on the right track.
Doctor, so I have a question. If you have more than one child, and one child has these problems and the other one doesn't, obviously the medicine only goes to the child with the problem. But what about the behavioral things? Do you treat both children in the same way, or do you treat the one with the problems with, what is it called, kid gloves? Mm-hmm. You know what I mean?
Yeah, so that's a very, very good point. That is sort of aligning the parent's behavior to the child who is perhaps much more sensitive to what is going on. And sometimes that's very confusing for parents. And I think that is a time where you really turn to professionals as a sounding board, where you can talk about how to sort of back off certain things and how to be kind of much more hands-on on others. Because your behavior is going to either aid and abet the problem, or it can kind of reduce it. And that's what we call behavioral therapy, cognitive behavioral therapy, or other types of therapies that go along, which can, because it's very hard as a parent, it's very confusing. And that's where a professional might be helpful. And I think you're pointing out to the complexity and the rich tapestry of the way children are kind of braided together, and how they're how do they develop, and every child is unique. So,
do you know, when I was a kid, I was told I had to wear glasses, and I pretended I did. I never actually wore them. I was kind of I would fake it. In other words, is it possible to fake? Like, if you are a child and everybody's kind of all over you because you got a psychological problem, can you fake it so that maybe around certain people you just don't display those behaviors?
Oh, absolutely. And we see that all the time, where the child is trying to hold it together within the school setting. And when they come home, everything sort of breaks apart, and the parents see the whole thing in full swing. As the illness progresses and no intervention is put into place, no treatment is put into place, it begins to bleed out within the school setting as well, where they can no longer hold it together. And so there's this, you bring up an excellent point. We don't want it to get to the point where the dam sort of is breaking, and you're seeing it bleeding into other places where the child is very laboriously trying to hold it together. So yes, we do see that.
But we also want the child to be able to feel like they can share things with some of their peers or their adults that they don't have to be afraid to share.
Right, and communication about mental illness and mental health should become a common dialogue within communities, where you talk about it just as you would a headache or a stomachache, so that it becomes commonplace, and it doesn't so much stigma is not attached to it. And that occurs with exactly what you're doing, which is educating the public and getting them to be more comfortable with these concepts.
The best thing that ever happened to me was becoming a dad, and we love our children. We don't want to see them sick in any way, whether it's physical or psychological. Do you have a website we can go to for more information?
Yes, it is chrichmond.org/VTCC.
Okay, very good. Doctor, thank you for taking the time to do what you're doing with us, and for what you've chosen to do with your life. You're making the world a better place. Thank you.
Thank you so much for doing this.
You're welcome. We'll be right back.
Fox News Radio, I'm Chris Foster. For the first time in nearly 60 years, Cuba has a leader who's not a Castro. Miguel Diaz-Canel is elected president by Cuba's National Assembly.